Hello, my name is Joe Champagne, and I'm a physical therapist. I work at Mount Shasta Physical Therapy, and we have locations here in Mount Shasta at the Wellness Center and also at School Hill Wellness in Weed. And I'd like to talk to you about the role physical therapy can play in treating low back pain. If you're watching this program, there's a good chance that you or someone you know has experienced low back pain before. And that's not uncommon. Low back pain affects 9 out of every 10 people at some point in their lifetime. And of those people who experience low back pain, about 90% of them experience it on a recurring or constant basis. So in going through the program today, I'd like to first demonstrate the evaluation process and explain its various components, and then demonstrate some of the physical therapy techniques for treating low back pain. With us this morning, Monica Quintero has kindly agreed to be a model and demonstrate some of the evaluation techniques and some of the evaluation and treatment procedures. So what we're going to start with first is the initial evaluation. After you've discussed your low back pain with your physician, the physician will order physical therapy, and you'll schedule your first visit for physical therapy, and that visit will consist of the evaluation process. In that visit, we'll discuss the history of your low back pain, take you through a clinical exam to see where your particular needs and deficits are, and then from that, the therapist gathers the information that they need to develop a treatment program that's specific to meet your needs. So I'm going to start with Monica. I'm just going to ask you if you could tell me when you first started to experience low back pain.
I had back pain around 10 years ago.
And did that start all at once? Did it come on suddenly? Did it come on over time?
It came suddenly. I used to do a lot of exercise and free weights.
Okay.
And I start doing with my knee, and then it comes to my back.
Okay, can you show me where you feel your pain?
Like here in the lower back.
Okay, and any place else? Okay. So Monica, could you tell me the types of activities or things that you do that make your back pain worse?
If I exercise a lot,
okay,
it makes it worse. Or if I carry a baby, so if I hold it for a long time,
okay,
it makes it worse too.
Okay. Now, can you tell me several things that make your back pain better? If you were hurting a lot one day, what would you do to relieve that back pain?
I lay down and I use the roll to put it in my back.
Okay.
I used to roll it, and I use the ball too.
Okay. And what types of treatment have you had before? Have you had any treatment for this before?
No, I went with a chiropractor once.
Okay. Okay. From this point, the history portion of the exam would continue, and there would be further questioning regarding Monica's daily activities. Does she have any difficulty sleeping? What type of treatments have been successful for her in the past? What things has she tried that hasn't worked? The purpose for this is it gives us some insight as to the types of stresses that aggravate her symptoms and allows us to go into the examination looking for particular problems or deficits. So, Monica, I'd like to actually start by having you do a couple of movements for me. And as you go through these movements, I just want you to tell me if it has any effect at all on your back pain.
Okay.
So if you wouldn't mind, I'm going to have you turn around. Yeah, take one step back towards me. Okay, good, yeah. And just stand there for a moment. What I'm checking for now is alignment, both at the pelvis and the spine, and seeing if there's anything that appears to be out of position or out of alignment for Monica. Okay. Next, Monica, could you forward bend for me like you were going to touch your toes, but only go as far as you can without hurting. Okay. And come back up. Did that have any influence on your back pain?
No.
Didn't change it? No? Okay. Now could you backward bend for me? Good. And come back up. Did that have any influence on your pain?
Yeah.
Show me where.
I feel it right here in the center.
Okay, thank you. At this point, there would be several other movement tests that we would do to see if Monica had any pain with particular movements or directions of movement. What I'd like to do next is have Monica come lie down on the treatment table and demonstrate a couple of techniques that we do for evaluating her low back pain, and then we'll move right into some treatment. Do you have any pain right now?
No.
Okay. If I do anything that causes any pain, let me know right away, because we don't want anything to hurt, and then I'll just ask you to tell me about that pain.
Okay.
Okay? Okay, what I'm going to do first, let me do this for you. I'm going to gently lift your leg, and I want you to tell me when you feel like it starts to get tight.
Right now.
Right there. Okay, where do you feel that?
Right here.
In the back. You don't have any back pain with this, though? Okay. If I bend your knee a little bit, does that tightness go away? Okay, I'm going to bring your leg back down, and I'm going to do the same thing on this side, okay? Let me lift your leg up. Tell me when you start to feel the tightness and where.
Right now.
Okay? Nothing in your back? Okay, I'm going to bend your knee. Tell me what happens.
Goes away.
It goes away. Okay, I'm going to bring your leg back down. Okay, if you could, I'd like you to bend your knees for me. Okay, does that change your pain at all? No? Still no pain? Good. Okay, bring your feet together, your knees together. Okay, yeah, just relax your hands wherever's comfortable. And I'm going to gently rock your knees from side to side, a little further. Good. How does that feel to your back?
It feels good.
Feels good? Okay. No pain. Good. Okay, now I'm going to bring your feet apart a little bit. Okay. There are further evaluation techniques that we can continue to perform. At this point, though, I'd like to continue into a treatment, and in doing so, I'm going to ask Monica to do a couple of exercises that I think will be beneficial for her and benefit most people who have chronic low back pain. Hey, Monica, the first thing I'd like to have you do is I want you to take your pelvis, and I want you to just roll your pelvis until you feel the small of your back press into the table gently. Okay, and release that. How did that feel to you?
It feels like tight.
Feels a little bit tight? Okay, I'd like you to try that, maybe 5 to 10 repetitions, and tell me if it changes over those 5 or 10 repetitions. And this is a very gentle exercise, and I'll proceed, when she's done, to try something a little more challenging. Okay, and how do you feel with that?
It hurts a little.
You get a little bit of pain? Okay, where do you feel that pain?
Right here in the back.
Right across your low back. Okay, let me ask you to try this. I'm going to have you bring one knee up. Use your left hand to hold it across your knee, just like that. Now bring the other knee up. Hold it with your hand, okay? And I'd like you to go ahead and gently bring your knees into your chest. And now bring your legs out to arm's length, very slowly, and try that 5 to 10 times. And in the same way you just did, let me know how this feels to your back.
It feels better.
Starting to feel better?
Yeah.
Okay. Go ahead and continue. Just a few more repetitions. Most low back pain will have a preferred direction of movement, a direction of movement that makes the pain less or you feel better. And that's one of the things we'll investigate for during the evaluation process. Okay? Then come on down, slowly. The last technique I'd like to perform is for Monica to engage her abdominal muscles, and in particular, one particular muscle that's very important in stabilizing the spine. It's a muscle that often gets ignored. We don't usually exercise this muscle when we go to the gym or do home exercise. And I'm going to instruct her on how to engage and recruit that muscle now. What I'd like you to do, Monica, is take your hand and just rest it across your belly. There you go. Okay, and just get a nice natural breathing pattern going. Good. Okay. And what I'd like you to do is I'd like you to draw in your abdomen, and in doing so, you should feel your hand drop down with your abdomen. Good. Now release that. That's the muscle you want to engage. What I'd like you to try and do is draw in your abdomen. Good. Hold that while you're breathing. Don't hold your breath. Good. Perfect. And now release it. Okay, how does that feel for your back? Feels good. Okay, go ahead and try it again, and I'm going to give you an exercise to challenge that muscle a little bit. So you're going to draw in your abdomen. Keep breathing, don't hold your breath. And now what I'd like you to do is just take one foot and slide it towards the foot of the table. Good. Bring it back. And now try the same thing on this side. Good. And bring it back. Excellent. Keep going side to side for about 3 or 4 repetitions. What I'm going to do now is, with Monica engaging this muscle, is I'm going to slide my hand and see if she's able to stabilize her spine. Keep going. Good. Hold that in. Hold that in. Good. Good job. It's not moving. Good. Okay, go ahead and rest. In developing spine stability, you're able to do more things in your daily activities with less pain. You can do more and hurt less. At this point, I'd like to show you a couple of things on the spine model that will help you understand why you're having back pain and what you need to do to help correct your back pain. So, having completed the physical therapy evaluation, we'll explain the evaluation results to the patient, explain the treatment plan associated with those results, and an important part of the treatment I find in working with most patients is helping them understand why they have back pain. So, Monica, when we were doing the exercises on the table, we had you engaging abdominal muscles to help support and stabilize your back. Another important muscle group, which we will show you with another exercise, are strengthening the muscles that actually help connect the individual vertebrae and stabilize them in position in relation to each other. These muscles here, as they connect to the vertebrae, are going to help keep your spine still, so that as you're moving, doing things in your daily activities, the vertebrae aren't going to move inappropriately or excessively and aggravate your symptoms and your pain. From this point on, we'll continue with your therapy on a series of visits. And each visit, you'll let me know how you're responding to the therapy that's been provided thus far, how you're responding to your home program, and that will allow us to progress your home program and your physical therapy treatment here in the clinic in a way that hopefully will help you be successful in treating your low back pain. In closing, I'd like to thank you for watching and also invite you to come by one of our facilities and see the services that we provide, ask questions that you may have. And if you have any questions regarding physical therapy and how it may help your low back pain, feel free to discuss it with any of the therapists here at our facilities, and especially with your doctor.